I'm Leena Minghani. I'm a lawyer who works with Doctors Without Borders Access Campaign. Main objective is to increase access to affordable medicines and diagnostics for diseases such as HIV, hepatitis C and DRTB. So I'm here to raise awareness about advanced HIV diseases and the diagnostics and drugs needed for it. So, advanced HIV disease is basically people living with HIV who are very vulnerable of dying due to opportunistic infections. One of the reasons that people living with HIV are still dying is advanced HIV disease. Now, one of the markers of advanced HIV disease is very low CD4 counts. And this is what I'm here to raise awareness about, that we should focus on providing the right interventions to people with very low CD4 counts, so that, even if we are providing HIV treatment, they're not dying of opportunistic infections. And this is really very critical if we are to reduce AIDS-related deaths in India. So CD4 count is usually done to look at the status of your immunity. If your immunity is down, you acquire a lot of life-threatening infections. So for every person living with HIV, a CD4 count test is very important, particularly at the time of initiating treatment and monitoring treatment. Now, when CD4 counts are low, below 200, and particularly below 100, then they get life-threatening infections such as extrapulmonary tuberculosis or cryptococcal meningitis or some serious forms of pneumonia. And they need hospitalization, they need care, they need screening for certain diseases. All of that is something that we really need to link back to low CD4 counts. So if we are aware that low CD4 counts come with the risk of these life-threatening opportunistic infections, we can screen people early and save their lives. When you're living with HIV, and your viral load is undetectable because you're on antiretroviral treatment, and your CD4 is above 200, that basically means your quality of life is very good. You can live your normal life, you can go out to work, you can do all the things that are necessary to live a perfectly, good quality life. However, when your CD4 counts are less, and you fall into the category of risk of advanced HIV disease, that basically means that unless you are screened for certain diseases, you could acquire them and be at the risk of dying. So many people who come for HIV testing already have very low CD4 counts. So if we are able to provide the right package, we can save their lives, and they could live as other people living with HIV who have suppressed viral loads and a good CD4 count. So this is really very important. It's a category of people living with HIV who are very vulnerable and who at the time of testing have low CD4 counts and could acquire these life-threatening infections. And if we could focus in the ART centers and in monitoring on these people, you could see that all of them could live perfectly good quality lives if we have addressed advanced HIV disease. And particularly the National AIDS Control Organization, working with the state AIDS control societies, has made very rapid progress in putting people on antiretroviral treatment. Now, these are drugs that actually save lives and make your virus undetectable. At the same time, because of the pandemic, WHO had come out with a package for advanced HIV disease. That remains unimplemented in India as yet due to the delays of the pandemic. So post-pandemic, one of our appeals is that, both the Global Fund and National AIDS Control Organization implement the WHO guidelines on advanced HIV disease. And that will benefit states like Nagaland, because, in your cohort of people who are coming for testing and treatment, there are people with very low CD4 counts. India has done tremendously well on prevention, and of course the prevention program has been cited as one of India's biggest successes. At the same time, you have more than 1.5 million people on antiretroviral treatment. But the third pillar that I say, the 90-90-90 that UNAIDS talks about, test 90% of people living with HIV, put them on antiretroviral treatment, and make sure they have no virus detected, and reduce 90% deaths. In India, we are still to reduce the number of deaths from advanced HIV disease. And that can be done once we implement the WHO guidelines.
So, what are the WHO guidelines? Just in brief for everyone to understand.
WHO guidelines are, in a nutshell, focus on people with low CD4 counts, screen them for opportunistic infections, and treat them and prevent the opportunistic infections from happening. That in a nutshell are the WHO guidelines. And we can do them at the ART centers themselves and link them to referral centers. So if the WHO guidelines are implemented by NACO in the coming year, then we can see some rollout of that package in Nagaland as well. TB and HIV actually go hand in hand. And, TB is one of the biggest killers of people living with HIV. Now, what has happened, in terms of scientific progress, there's a very simple urine test that screens people living with HIV for TB. That's called the TB LAM test. The TB LAM test is still to be rolled out in India. And testing for TB has been particularly difficult in people living with HIV because it's very difficult to get a sample from a person living with HIV. Either they have extrapulmonary TB or they can't produce sputum. So the urine test for screening TB in people living with HIV with low CD4 counts is a life-saving intervention that should be rolled out in India and, of course, the Northeast. If we address advanced HIV disease, we also reduce stigma in the community because people tend to stigmatize people who are very sick with HIV. So this is one of the measures to reduce stigma in the community against people living with HIV is to treat advanced HIV disease effectively and prevent advanced HIV disease. The most effective interventions that now the World Health Organization is recommending to member states like India is a triple elimination in pregnant women, so that pregnant women can be offered a test for syphilis, HIV, and hepatitis B, and offered preventive and treatment for all these three diseases. So, to put a majority of women who are pregnant, to screen them for these three diseases, and to prevent and treat them for it, and the child. So that's your triple elimination: test, prevent, and treat HIV, hepatitis B, and syphilis in pregnant women. One of the things that we are watching happening is that people, among groups that are working on HIV, civil society that are working on HIV, people are not aware about the risks of a low CD4 count and advanced HIV disease. So the purpose of this workshop is to raise awareness among key populations and vulnerable communities, HIV networks, about the risk of advanced HIV disease and the need to address them in community-based interventions.